Now we're just going to go through the basic functions of the LifePak 15s and 20s. So I do have a simulator connected to both of these. So this is our patient for right now. And so first thing we're going to talk about is manual defibrillation. So we have our shockable rhythms, which would be VFib and a pulseless VTach. So if we see a patient coming in VFib like this, we're going to start with our ACLS protocol. And one of the things is to shock the patient. So with that, we're going to select Energy Select, which is preset at 200. This one has been set to 10 from when I did our checks, but easy to change. You can do the Energy Select on either side, or you can use the toggle button. And so once your energy is selected per your physician or per your ACLS protocol, we're going to charge it up. We're continuing CPR while it's charging, and we're going to hold down the shock button. It will print out your shock that was delivered, and hopefully you can see your patient going into a more normal rhythm there. Next thing would be our synchronized cardioversion. So a great example of patients for this would be our SVT patients. Maybe we've tried to get them to vagal down, bear down, blow really hard into a paper bag, and nothing is working. Maybe we've tried adenosine, doing that protocol, nothing's working, so now we're going to have to shock the patient. So hopefully we'll be kind to these patients and sedate them. Nobody really wants to be awake during this. And so we have our nurses there, we have RT there, your physician at bedside. If you're a unit that has a pharmacist, you may have a pharmacist at bedside as well. So with that, everything is ready to go. The first thing you have to do is hit the sync button. When you hit the sync button here on your 15, it's right here. On your 20, it's right here. Same thing will populate on both. You'll have these little triangles populate over the QRS. And so that is how you know that you have hit synchronized. One, it's green and blinking, and you see your triangles. So now that they're sedated and out, your physician will tell you what to shock the patient at. Typically, we hear 50, 100, 150 joules. Depends on the patient's weight, depends on your physician. So whatever your physician orders you to do, Energy Select, again, it's the side buttons or your toggle. So I'm gonna take it down to 100 joules. Same thing. And we're gonna charge it up. Charge it up. The big difference with this is that we hold it down for just a second. And the reason behind that is because that will send the correct timing of the shock through the machine. The machine will say, okay, now it's time to deliver the shock. If you were to do a shock and you hit your button and maybe it didn't deliver your shock, the machine knows, because it's already synchronized, not to give that shock. It knew that that was the wrong beat. So that's why we like to hold it down for just a second. Let me see if maybe I can get one here so it's a little easier to understand. So this would be if I just, nothing has happened. So now I know I need to hold it down. Okay, last thing is pacing. Pacing can be a little bit tricky. And so for each of these, it's really very, very similar. You do have a pacer button right here. So if you have a patient that comes in and they're in this weird sort of junctional rhythm there, maybe they're in a 2nd-degree block or 3rd-degree block, whatever the case is, if their heart rate is super low and we're going to need to externally pace them, you have your patches on your patient in the appropriate spots. When you hit your pacer, you will also see your little triangles populate over that QRS, and then you have a rate and a current on both. All right, and so your rate is literally your heart rate. So it's just, what do you want your heart rate to be? Typically a minimum heart rate is 60, so that's kind of where we like to start. Everybody has a little bit different of a normal. So you have your rate there, and you can change it by hitting the buttons on the side, but you can also change it by your toggle. And then your current starts at 0. Your current is your milliamps, or how much electrical impulse are we gonna need to send through those patches to help that heart really start beating. So there's a couple of ways to do it. You can kind of start slow, and you'll start seeing your pacer spikes populate there. I think it's easy to match 1-to-1. So if you have a rate of 60, then you target a current of 60. Again, that doesn't work for everybody. This is very much a trial and error until you find what works for your patient. So right now I have a current of, a rate of 60 and a current of 60. And so you can see these pacer spikes, but you can see they're not quite synced up yet. So what does that tell me? That maybe I need to go up a little bit more. So let's try to increase our rate to 70 and increase our current to 70 and see how that works. Here we go. So now we have good capture here. This is called electrical capture. We can see it on the monitor, which is great. But what is the gold standard? What does your patient look like? So this, you're going to want to capture mechanical capture. Of course, we want to check a more central pulse. So we have a carotid and a femoral that we want to check. If you can't feel a pulse there, you have a different issue. Now, it's great if you can feel a peripheral pulse in their wrist. That means that you're really perfusing to the rest of the body. And so with this, it is very trial and error. A little bitty tiny Meemaw might not be able to tolerate 70 milliamps. Her capture, she might capture at 40 beats per minute and a 20 milliamp current. It just depends, versus a larger patient, maybe a 500-pound patient, is gonna need a lot more. So maybe their rate will be more 70, 80, 90, and their current could be 90, 100, 110 milliamps. Very much trial and error. So you just have to play with it until you get good capture. Again, electrical capture here, mechanical capture, feeling the radial pulses, central pulses. The last thing with this is that without fail, you finally get your patient comfortable and you have your rate set and everything, and some cardiologist is going to come in and say, hey, I need to see what they look like without the pacer on. So first thing you're going to do is, one, educate your patient that, hey, we're going to take this pacer off for just a second and you're going to feel kind of crummy again, but we're all right here. And two, you have a pause button function, okay? So with the pause button, if you just hold it down and continue to hold it down, it will automatically start printing your strip out. It will pause your pacer, so that way this physician can say, okay, I know what I see now, thank you. And as soon as you lift your finger up off of that pause button, your pacer will begin again. So if you have paused your pacer, you need to, again, check that you have capture here and that you have capture peripherally or centrally. Same thing with this guy, holding the pause button down, it automatically prints and pauses that pacer. The physician sees what they need to see. As soon as you lift, pacer turns back on.